Good morning, Dr. Gary here. We are approaching Christmas time. Anyway, and happy holidays to all. Today, we are dental practice brokers nationwide. And today's topic is the value of your practice. The value of your practice is more than the EBITA value, or net profit with the doctor's salary factored back in. And we'll talk about that today. We're currently now in 28 states selling dental practices nationwide. We have 10 employees, which includes 2 CPA accountants, marketing director, operations director, and development acquisition team. So we are we are available to you every day except Christmas and Easter. The phone is answered from 8:30 a.m., 8:30 a.m. on the East Coast time to about 9:30 East Coast time. So call us if you want to chat, just to need advice. We're here to help you. Also, if you want an appraisal of your practice, we can help you with that. No problem. And sometimes we're happy to give you a market appraisal to give you an idea what your value is. Well, we'll need some supporting documents for that, of course. Now, everything you're about to hear today is for entertainment purposes. It is not legal or business advice. So, in the event you also have a larger practice and you want to sell to a DSO, please call us. First of all, we don't charge a commission. Most of them all pay our commission, so you won't have to pay a commission. Secondly, we can occasionally get legal fees reimbursed upon successful closing. And we've done that a number of times. So let us know. Give us a call, and we'd be happy to chat with you. So today's topic is, the value of your practice is not, especially when selling to a DSO, it's not only about your EBITA, which is your net profit factoring back in the doctor's salary to work there. It's far more than that. First of all, the DSO or the buyer has to be excited about your area. They want to go into your area and develop it. And if it's the first time for a DSO in your state, they may not be as excited. They may be looking for a significantly larger practice. Whereas you have others that are focusing on your area. It's not all just about the EBITA, which is earnings before interest, taxes, amortization, and so forth. It's more than that. They want to be excited about an area. They may pay more to be in a certain area that they're trying to develop or get a presence in. And that's what their focus is. I find so many doctors, and I had one just this week, all he wanted to talk about was EBITA. He's got to get his EBITA up, got to get it up, got to get it up. And I explained there's more factors that get involved in that. Also, what is your compensation going to be? If the DSO is paying you a lower compensation, let's say 25, 30% or 30%, compared to 35% when you work as an employee getting paid on collections, well, your EBITA is going to go up. The lower your reimbursement as an employee, the higher your EBITA is going to be for the office. So, now you're going to be working for them for a couple of years, and you'll be making significantly less. You'll be making less money. So you've got to factor that in. But not every doctor does. They keep focusing on what is the EBITA, what's the EBITA, what's the EBITA. It's more than that. And I'm working, I'm in the trenches with these DSOs, in contract, making deals, letters of intent. And I see, I see what's going on. I see what, what their valuations and what they're basing their valuations on. We can help you here. I mean, we're in the trenches. We're the cop on the beat. We can see what of each different DSOs is looking for, or where they're trending towards, or how they're changing. That's what we can help you. Again, they pay our commission, and I get the same commission from all of them. But occasionally we could also, when you work with us, we could try to get your legal fees reimbursed at closing, and we've done that a number of times. But please call us on that. Call us to discuss so you understand real evaluations. Don't just focus on big numbers that they're throwing out at you. Just like this doctor this week, this is case study. all the doctors doing is focusing on EBITA. You just can't do that, because they can also reduce the amount of down payment, increase the amount of holdback, and that will affect it. You know, they could give you glorious, huge offers, but with a lower down payment, and there has to be an earn out or extra monies in the future that you've got to bump up the practice profit to before they release those monies. So yeah, they'll give you a high EBITA, but they're only giving you a lower down payment and holding back more money and making you stay 5 years to work. You've got to factor all these in. We could help you with that. We could guide you through the path. And we're learning all the time, and we're in the business. So we hope that you give us a call and we could chat about that. All right, on the next video, we're going to have more information about changing times and what's going on. So hit your subscribe button so you're alerted to these things. Great talking. You have a nice holiday season, everybody. Bye now.